1 in 8 new mothers in the U.S. suffers from postpartum depression, according to the CDC. Even more alarming, 3/4 of them go undiagnosed or untreated. In tonight's Eye on America, Nikki Battiste takes us inside a new facility that offers a new approach for postpartum mothers and explains why it's still out of reach for so many.
It's a big jump going from 1 to 2, isn't it? It is.
For Catherine Schiefer, who gave birth to Owen 5 months ago,
You taking good care of your mama?
motherhood the second time around has felt drastically different. Her daughter Cora is 2.
Yeah, I'm a little anxious. Did experience rage this morning. Again, it's not something that feels comfortable for me. So
Scary.
yeah, scary.
The 35-year-old lawyer was recently diagnosed with postpartum depression after her husband John encouraged her to get help.
I had the thought, in the middle of the night, like, I don't want to be here. And when I say not be here, I mean on this earth. Like, it was
Suicidal thoughts.
yeah. I mean, I know my kids need me and I love them and I want to be here for them. So to have thoughts like that were alarming. It was alarming.
Raw and powerful, Catherine's thoughts are shared by so many new mothers. Suicide is one of the leading causes of death in a woman's first year postpartum.
I think it's destigmatizing that we don't just have to have one feeling of joy, but that becoming a parent can also have a great deal of grief and loss for a life that you used to have.
Dr. Sarah Orrick, a reproductive psychiatrist, says most insurance policies don't come close to meeting the demand for mothers in need of mental health help.
Reimbursement for mental health care in this country is abysmal, to the point where there's mostly people working out of network.
Ask new mom and former social worker Delindra Buys.
There's so many moms that could utilize so many different services, but they can't because they can't afford it.
After she was diagnosed with postpartum depression, she wanted to come here.
He loves the water.
To Fourth Try Sanctuary outside Detroit, where doulas take care of babies so moms can shower or nap. But she couldn't afford it. The founders rely on donations to provide care for some women, like Delindra Buys, for free.
It breaks my heart to hear him cry.
Catherine comes here too, but she pays out of pocket, and it's pricey.
Exhale, you're in charge.
There are also yoga classes, lactation consultants, and mental health support groups, bringing a new dimension of postpartum care. It is much needed relief for 32-year-old Delindra. She and her husband Eric turned to IVF after struggling with infertility. Their son Cassius was born at 26 weeks, weighing just 2.5 pounds.
The guilt was the hardest thing and still is the hardest thing.
How would you describe postpartum depression?
A hurricane, chaos, mayhem, a storm.
Where would you say you are today in the storm, in the hurricane?
It's not raining as heavy.
And other moms have come up to me and whispered to me, it does get better.
With every conversation, those whispers grow louder, helping the stigma and shame around postpartum fade away. For Eye on America, I'm Nikki Battiste in Ferndale, Michigan.